How do new imaging techniques help juvenile osteoporosis? Imagine being able to see inside a child's bones with incredible detail without causing them discomfort or exposing them to too much radiation. That's exactly what new imaging techniques are making possible for children with juvenile osteoporosis. These advancements are transforming how doctors diagnose and manage this condition. Traditionally, dual-energy X-ray absorptiometry, or DXA, has been the go-to method for measuring bone mineral density in children. It's quick, involves very low radiation, and has reference data specifically for kids. This helps doctors determine if a child's bones are weaker than they should be. Sometimes, DXA is combined with vertebral fracture assessment software, which can detect tiny fractures in the spine that might not cause symptoms. This is crucial because children with osteoporosis often have fractures that go unnoticed, and early detection can lead to better treatment. In addition to DXA, lateral spine radiographs are still used to spot vertebral fractures. While they provide good images, they involve higher radiation doses and can be tricky to interpret because of the child's anatomy. To get a clearer picture without radiation, advanced imaging methods like high-resolution magnetic resonance imaging are emerging. These MRI scans reveal detailed views of bone microarchitecture, such as the tiny trabeculae and the thickness of the outer cortical layer. This information helps doctors understand not just how dense the bones are, but how strong and resilient they really are. Artificial intelligence and deep learning are now being applied to analyze MRI and CORT scans. These technologies can identify subtle signs of osteoporosis that might be missed by the human. When MRI and CORT data are combined, they can give a comprehensive picture of bone health, allowing for earlier diagnosis and more personalized treatment plans for children. Some newer methods also include finite element analysis, which uses imaging data to estimate how much bones can withstand. This helps doctors predict fracture risk more accurately and monitor how well treatments are working over time. All these innovations help detect juvenile osteoporosis sooner, find fractures that might otherwise be missed, and give a full understanding of bone quality. They also reduce the amount of radiation children are exposed to compared to older methods. Since children are still growing, understanding how their bones are developing is vital, and these techniques provide insights beyond just bone density. Of course, choosing the right imaging method depends on each child's specific situation, and specialists experienced in pediatric bone health are essential for interpreting results correctly. Imaging is just one part of a complete approach that includes clinical exams, lab tests, and sometimes genetic studies. These combined efforts help ensure each child gets the best, most personalized care possible. Always remember, if you have concerns about juvenile osteoporosis, consulting a healthcare professional is the best step to take.